So I'm very excited to speak to you about religion, spirituality, and health today. So let's just go into it. First of all, I will try to distinguish between the terms religion versus spirituality, then review research on mental and physical health, examine a theoretical model that helps to explain the effects that I'll be talking about, talk about future directions, provide some conclusions, and provide you with further resources that you might decide to consult with should you want more information. So, are religion and spirituality the same or are they different? On the one hand, religion is unpopular and potentially divisive. People believe different things and sometimes there's conflict there. Spirituality, on the other hand, is popular. It's inclusive of everybody. It's common to all, but it is largely self-defined. Through most of recorded history, spirituality and religion have been considered the same thing. Within the past 30 years, though, with the increasing secularization, especially within the academic world, spirituality has become separated from religion. So let me illustrate how spirituality has been changing. This was the traditional understanding of spirituality. Spirituality, the spiritual person, was considered the deeply religious person whose life was centered on their religious faith. So the spiritual people were a subgroup of religious people. These were individuals like the spiritual were like Gandhi, for example, or Jesus, or Krishna. So these were the deeply the religious people were called spiritual. And then people who are not religious or spiritual were secular. So you could compare these groups on their level of mental health and on their physical health. You could say, who has better mental health? Who has better physical health? Those who are deeply religious, those who are more superficially religious, and those who are neither religious nor spiritual. So that was easy to do. You could compare the groups on their meaning and purpose and well-being and peace and hope, the positive aspects of mental health, and you could compare them on the negative aspects of mental health. And then consequently, you could compare their physical health as well. Their likelihood of developing cardiovascular disease or cancer, or how long they live, their length of life. So that was easy. But then spirituality began to expand in its definition. The current understanding is that there are religious people and there are spiritual but not religious people, and there are those who are neither religious or spiritual. So that's okay. You can still look at the mental health and physical health and compare them between those who are spiritual but not religious, those who are both spiritual and religious, compared to either religious or spiritual. You can see which of these groups have better mental health and better physical health. However, the understanding of spirituality has expanded even further, such that spirituality now is mental health. So this is the way that spirituality is now being measured within academic settings. Spirituality is measured as religion, as not religious, and as good mental health. Now that is problematic from a church standpoint. Because if you define spirituality beforehand as good mental health, then if you look at the relationship between spirituality and mental health, you will always find that they're positively correlated because you've defined spirituality beforehand as good mental health. So for that reason, I'm going to avoid using the term spirituality in discussing this research and instead talk about religion. Excuse me. Now, if I'm going to quickly sum this because I only have 25 minutes here to talk about it. So if you want to know more about it, the Handbook of Religion and Health, the third edition, out in spring, early summer. This is a massive book. It has 2,000 pages, nearly 600,000 words. It covers all of the research on religion and health. It's my co-authors are both from Harvard University. One is a biostatistician who has reviewed and endorsed all of the research that is included in this third edition of the handbook. So if any of you are really interested in this topic, I would encourage you to get the third edition of the handbook when it comes out, because it thoroughly discusses the research. Now let's look at some of the research on mental health. Depression. Many of you are familiar with depression. It is one of the most common emotional disorders in the world, especially among medical patients. So you're going to see 1/3 to 1/2 of medical patients will be suffering with some level of depression. Now, religious involvement, on the other hand, is related to much lower depression. So of the 444 quantitative studies that measured depression levels and religiosity, more than 60% found that religious people are less depressed, recover more quickly from depression, and religious interventions actually result in a more rapid reduction in depressive symptoms than other treatments, particularly in religious individuals. Now, this is a recent study out of the Harvard School of Public Health. So the Harvard School of Public Health is the top public health journal in the world, academic institution in the world. These are researchers now at the Harvard School of Public Health who are studying the effects of religious attendance, frequency of attending religious services on the likelihood of developing a depressive disorder. Now, this sample is nearly 10,000 young people, average age of 23. They were followed over a period of up to 6 years at the risk of developing a depressive disorder among those at different levels of religious attendance. So what they found was that there was a more than 30% reduction in the risk of developing a depressive disorder among young people who were attending religious services at least once a week. Now, this is a study that was done in the United States. So most of these young people are Christian, and so Christians attend church. So those who were attending church more often were less likely to develop depression. What about suicide? Suicide has become a big problem around the world, and it's been increasing in the United States. We've noticed this, as well as in other countries as they have become more secular. So of the research that's been done, of the 141 studies that have looked at this relationship between religion and suicide, 75% found that religious people are less likely to have suicidal thoughts, make suicidal attempts, and actually commit suicide. So religious people just don't commit suicide as often as do less religious people. Now, here is a study out of the United States published in the British Medical Journal or the British Psychiatry. This was a random of 20,000 adults in the United States. And these individuals were followed for over 18 years. And among those people who attended religious services at least twice a month, there was a 94% reduction in the likelihood of actually committing suicide. This is a study here of 90,000 women in the United States who were followed for about 14 years. Again, you see that those who are attending religious services at least once a week are nearly 7 times less likely to commit suicide than those who never attend religious services. Now, if you look at this relationship in a very fancy statistical model, a proportional hazards regression model, you find that that controls for other risk factors for suicide. You find that among those who attend religious services once a week or more, there is an 84% reduction in the risk of committing suicide. That's a hazard ratio of 0.16, which is highly statistically significant, as you could imagine. And again, it reflects the 7 times lower risk of suicide among those who are attending religious services at least weekly. Now, this is another study out of the Harvard School of Public Health looking at the risk of dying from a death of despair, a death of despair. And they define deaths of despair as deaths due to drugs, illicit drugs, illegal drugs, alcohol use, or suicide. Okay, so drugs, deaths from drug use, like heroin, cocaine, marijuana, stimulants, alcohol, or suicide. And they are studying 66,000 women who they've followed for 16 years. What they found is a 70% reduction in the likelihood of dying from a death of despair, a nearly 70% reduction. In other words, the hazard ratio, the hazard risk of dying from a death of despair was 0.32, which is 70% reduction compared to those who never or almost never attend religious services. So attending religious services, whether you're Christian, whether you're Hindu, whether you're Muslim, is very important in terms of reducing of death from alcohol, drugs, or suicide. This is looking in men. This is a 26-year follow-up study of over 40,000 men in the United States, and these were all health professionals. So these were dentists, pharmacists, optometrists, osteopaths, podiatrists, veterinarians. There were no physicians in this study, but every other kind of healthcare professional, and they were all men. Again, you see a 4% reduction in the risk of dying from a death of despair among those who are attending religious services compared to those men who never attend services. Also, if you look at alcohol use, abuse, and dependence, you find that nearly 90% of studies find that religious people just don't drink as much alcohol, don't use alcohol, and don't become dependent on alcohol. Again, this is out of nearly 300 quantitative studies. Also, illicit drug use. Again, 84% of studies show that religious people use, abuse, or become dependent on drugs, as do those who are less religious. And most of these studies, okay, it's very important to note, most of these studies are in young people in college, young adults. So that's true for both studies on illicit drug use and studies on alcohol use and dependence. Most of these studies are in young people that are just starting out their lives and are then also beginning to develop habits, including drug and alcohol use habits that will affect their health and mental health for the rest of their lives. So if those individuals are more religious, they are going to be less likely to use this drugs and alcohol, and they're going to consequently live healthier lives and more productive lives as well. They're going to be more likely to have good jobs and more likely to make more money and generally have better health because they don't have drug or alcohol addictions, which destroy people's lives. Okay, so here's a study, an 18-month study of very high-risk young people. These are adolescents between the ages of 11 or 16 have experienced physical or emotional abuse in the home. So these are young people, young adolescents who are at high risk to develop use disorders because they've been abused. And what you can see here is that for those young adolescents for whom religion was very important in their lives, they were, over those 18 months of follow-up, they were more than 50% less likely to develop a substance use disorder. So it seemed like if religion was important in their lives, then they were less likely over time to develop an alcohol or drug use disorder. So that's important because these young children are at high risk for developing a substance use disorder. Okay, what about anxiety and PTSD? 50% of studies show that religious people are less likely to develop anxiety. They cope better with stress, in other words. And of the experimental studies, many of which involve meditation, 3/4 found that these studies reduce anxiety. This includes yoga in terms of reducing anxiety among those with anxiety disorders. Now, here's a study we did, my research group and others did among a random sample of veterans, U.S. veterans. In other words, these individuals in the military off to fight war, and so they have a high risk of post-traumatic stress disorder because of their combat experiences. But among those who are more religious, again, you see a lower risk of developing PTSD, major depression, and of developing any kind of alcohol use disorder. And it's anywhere between 50% lower reduction in that risk and up to 70% reduction in risk of all of those disorders among those who are highly religious. It protects individuals from post-traumatic stress disorder, depression, and substance use disorders. Okay, what about the positive side of mental health, well-being and happiness? Religious people are also happier. They have greater well-being. They are more satisfied in their lives. That's true for 80% of quantitative studies that have examined this relationship. Religious people also have greater meaning and purpose in life. They have greater hope. They are more optimistic about the future. That's very important because people who are more hopeful, more optimistic, have greater meaning and purpose will work much harder in trying to recover if they get sick because they're more motivated. They have more reason to work hard in rehabilitation if, for example, they have a heart attack or have a stroke or are trying to recover from a surgery. They're going to be more likely to recover because they're more hopeful, optimistic, and they have more meaning and purpose. And religious people, therefore, ought to be more likely to recover and get better more quickly when they get sick. And that's exactly what's been found. I'll discuss that in a moment. Religious people also have more social support. They have stronger families. They have more friends because they are more likely to engage in social kinds of activities. So they have more social support available when they experience negative life stress. There is also lower rates of delinquency and crime among those who are religious. And in addition to that, religious young people are more likely to complete their education. They have higher grade point averages. They do better in school, and ultimately they get better jobs. They are less likely to drop out of their education, so they're more likely to complete their education, get better jobs, and be better workers as well. And all of that's been shown in systematic quantitative research. Even marriages are happier. So people who together, who attend services together, who worship God together, have stronger marriages. Their marriages are stronger, they're happier, and they are less likely to divorce, and all of that. So the Harvard School of Public Health recently followed these 66,000 women for a period of 14 years. Now, these women were all married at the time that the study was started. So at baseline, these 66,000 women were married, and they followed them for 14 years. And what they found was a nearly 50% reduction in the risk of divorce or separation among those women who were attending religious services frequently. Those involved in their religious community were less likely to end up divorcing or separating. Again, reflecting the power of religion to be able to support marriages and keep people together in these relationships. Now, this is how we understand the effects of religious involvement on mental and social health. It's a complex relationship, and I don't have time to explain it, but it affects a person's mental and social health across the individual's lifespan. So from childhood onwards, attending religious services, prayer, reading scriptures, volunteering for religious reasons, getting a religious education, being devout religiously, practicing, worshiping devoutly. All of that influences maternal stress, caregiver nurturing, the monitoring of young people, the ability to cope with trauma, loss, and negative life events, all of these different aspects. It enhances social support. It helps people live a healthier lifestyle. It guides people in making healthier choices, better life decision making, and consequently, it affects their mental health and their social relationships across their lifespan. Now, let's look at physical health briefly. I want to leave some time for questions. So we'll begin here on research on religion and health behaviors. So those who are more religious are more likely to exercise. They are more likely to exercise. They're more physically active, and that's certainly going to affect their physical health over the long term. They are less likely to engage in extramarital sexual behavior, and they have fewer sexual partners, and therefore they're at lower risk for developing sexually transmitted diseases such as AIDS, HIV, gonorrhea, other syphilis, transmission of the virus that causes cervical cancer. All of these risk, because they're safer in their sexual practices and they are less likely to have sex outside of marriage, they are at lower risk for all of these different sexually transmitted diseases. Unfortunately, though, religious people tend to eat more. They tend to eat more. They tend to be heavier. Religious people eat food, and on average, they tend to be heavier than who are less religious. And of course, that affects their health as well. If people are obese or overweight, they're going to be less healthy. And religious people do tend to be heavier. But they do eat healthier food. So their diet tends to be healthier. They eat more vegetables. They eat more fish. And all of that is good for a person's health. So that may, in fact, compensate for the heavier weight. Okay, One factor that influences their health is that religious people don't smoke cigarettes as much. They are less likely to smoke, and that's going to reduce their likelihood of lung cancer, chronic lung disease, high blood pressure, coronary artery disease, simply by not smoking as much. So in the United States, of the 135 quantitative studies, 90% show that religious people just don't start smoking when they're young, and they are more likely to quit. Okay. Now, during this COVID-19 pandemic, I don't know if you all are experiencing the pandemic over there in India, but we're having a very difficult time here in the United States. Now, religious people, on the other hand, seem to be protected. They have stronger immune functioning. They have lower levels of stress hormones because they're coping better. This has been shown in many studies, as illustrated here in this review. Also, cardiovascular functions are healthier among the more religious. Religious people have lower blood pressure in the majority of studies. They have better cardiovascular functions. They have higher heart rate variability, which is good. They have lower C-reactive protein levels in the blood, which is good. They have lower levels of cardiovascular reactivity when examined in the laboratory, when they're stressed in the laboratory. Also, overall, they have lower rates of coronary heart disease. Now, this is a study, a large study, 40,000 women. Again, this is out of Harvard and the Harvard School of Public Health. And the incidence of self-reported hypertension when these 44,000 women were followed over 12 years was about 10% lower among women who attended religious services on frequency. So this was recently published in the top epidemiology journal in the world, the American Journal of Epidemiology. Now, this is a study looking at the risk of dying from stroke. And again, you find that those who are attending religious services more often have about a 25 to 30% lower risk of dying from stroke. This was a study of 74,000 nurses that were followed over 16 years. And again, published in one of the top journals, JAMA Internal Medicine. Now, here's a study out of Iran in the Middle East. So what they found was that overall religiosity was associated with a much lower risk of developing coronary heart disease. It was somewhere between, among those with higher religiosity, it was somewhere between 74 and 70% lower risk. So a 70 to 74% lower risk of having coronary heart disease if they were more religious. Now, these are all Muslims. And of the Shia, the Shia type of Muslim. Mortality. Well, religious involvement is simply related to greater longevity. People who are more religious live longer. They are happier and they live longer. So what more can you ask from religion? And it's true based on many, many studies. 82 of 120 studies of longevity have found that religious people live longer. This includes the Harvard School of Public Health, which found that of 74,000 women that were followed for a period of 16 years, there's about a 1/3 reduction in risk of dying overall among those who attend religious services weekly or more often. That's true for cardiovascular disease in this study, and it's also true for cancer. So cancer mortality is also lower among those who are more involved in a religious community. Here's a study of young people. These are the 10,000 young people that they've been following for up to 6 years. I started out this talk about depression being lower among young people who are more religious. Not only are young people who are more religious less depressed, but they are at lower risk for developing cancer. So these are 23-year-olds on average age, followed for 6 years. There's a nearly 2/3 reduction in the risk of developing cancer among these young people over those 6 years. So basically, this is a summary of all of the studies on religion and health that have been done. And there have been, up to 2,500 quantitative studies. The vast majority of these studies that religious people are healthier. They're happier, they live longer. The vast majority of these studies, you can see here that almost 2,500 quantitative studies published in peer-reviewed academic journals find that religious people are significantly healthier. This is based, the research here is based on the second edition of the Handbook of Religion and Health, and the third edition that summarizes the research in the last 10 years does nothing but support the findings here that I'm illustrating in this graph. Okay, and then some studies find no association, but those are far fewer than those who find a positive association. Okay, here is how we understand this.
Sir, sorry to interrupt you. A gentle reminder that we have 5 minutes more maximum.
Okay, so should I stop presenting?
You have 5 minutes more, sir. Thank you.
5 minutes, okay. So here is the model of how we believe religion enhances health. The source is belief in and attachment to God. So that's very important. The person's connection with God. So the person's connection with God is then nourished within a religious community, and it is then manifested in terms of public religious practices, private practice such as religious commitments, religious experiences, and religious coping. This enhances human virtues such as forgiveness, honesty, self-discipline, generosity, humility. All of those human virtues and healthy life decisions influence a person's mental health by enhancing their positive emotions, their social relationships, and reducing the risk of negative emotions. All of that enhances the nervous system, the immune system, and the endocrine system, as well as cardiovascular functions, which enhance physical health and increase longevity. So this is a model out of the third edition of the handbook. Now, with example, Hinduism, it works basically the same way. Brahman, the supreme God, the connection with the supreme God, the Dharma, all influence a person's religious behaviors and then affects their health in the same manner. Now, in terms of future directions, the big challenges are with regard to definitions. We need more prospective studies. We need more financial support to do the research, and we need more well-trained researchers and academicians. Okay, so that's really the most important lack. We don't have enough trained researchers to study this. So basically, in conclusion, religious involvement is related to better social and behavioral health and improves these aspects of health over time. Religious involvement is related to better physical health. It enhances physical health through mental, social, and behavioral health pathways. These findings have huge implications for public health and for the costs of healthcare as religious involvement becomes less common. Many challenges to face in the future related to conducting high-quality research on religion, spirituality, and health, but none of these challenges cannot be overcome. So here are some further resources. I publish for free a monthly e-newsletter that you can sign up for. It's free. Just go to our website here and sign up for it. And I summarize the latest research in the field and other events and provide further resources. Also, I'd love some of you to come to our summer research workshop here in the United States in August of this year. This is a workshop where we train people to conduct research in the field of religion, spirituality, and health. We have had nearly 1,000 people from all over the world. We have had many people from India come to our workshop. And we also have some partial tuition scholarships to help bring people from India and other countries of the world to attend these workshops. So basically, if you can't come to the workshop, here's a book that summarizes the workshop. And here's our website. Just come and look on our website. There's lots of resources there. Come to our workshop and sign up for our e-newsletter that comes out free. Okay, let's open it up for discussion.
Thank you very much, sir. It was a very wonderful session. And we have a few questions from the participants. The first question is from Dr. Purna Pradhan of Municipal College, Roorkela, India. How can we activate current science to design experiment towards a possible immortal spiritual life?
Okay, so what we can do as far as healthcare professionals, what we can do is we can take a spiritual history in our patients. That's something that I think we can all do. Ask the person about their religious and spiritual beliefs, and we can support those beliefs in the healthcare setting. That's a very practical kind of application that we can do, and it's something that respects the patients and may help to support their use of religion and spirituality as a coping behavior. So that is what I would suggest.
Thank you. So there is another question from Akash Bhalu from IIT Madras. Why is science always considered as an adversary of religion? Atheistic people always start talking about the scientific mindset. Although the benefits of being religious are immense, as you have showed in your presentation. Why can't science and religion go hand in hand?
Oh, that's an excellent question. I think they should. I think science and religion are completely compatible. We cannot prove the supernatural, but we can show that a devout life can enhance a person's mental and physical health. We can study this scientifically, and the thousands, like I said, thousands of studies now show objectively, quantitatively, in terms of numbers, that religious involvement enhances a person's health. So science and religion are very compatible. And I think that it's been a mistake to think that science and religion are not, because they are. The truths of science should be completely the same for the truths of religion. They work together, but they are different ways of defining the truth. They're different, but they complement each other. They work wonderfully together.
Yeah, nice to hear that, sir. Actually, our Bhaktivedanta Institute also is to see that science and spirituality come together. So thank you very much. Yeah. So there is another question from Supali Pal from Sri Krishna Mission School. How being more religious makes people to low all the bad habits? Is it like being more religious any type of hormones in body, or something extra thing goes on in body if a person is more religious?
I think why people who are more religious, healthier, and don't use substances as much, I think religion helps people to be more self-controlled, more self-disciplined. And consequently, I think what's going on there is that, religion encourages people to have respect for their bodies, to be respectful for their physical bodies and not to hurt the physical body. And so it encourages people to not abuse their bodies. And it also gives people another way of coping with stress. because many people without a religious faith will turn to alcohol or drugs or sex or do other things that are not good for them. Whereas people who pray are more likely not to do those things. And as prayer helps to relieve their stress, they don't need to use alcohol or drugs because they have another way of coping with the stress. So I think that is why religion does that.
Excellent, sir. So there is another question from Adana Saha from Sri Krishna Mission School. Is religion evolved as a fruit of our consciousness? And what could be future if we consider our daily life religiously in the same sense, that is performing our life's work religiosity, our work religious?
Yeah, I think being conscious of one's religious faith on a day-to-day basis, there's a practicing the presence of God, thinking about God in your life on a day-to-day basis, I think can really make a difference. It's difficult to develop that habit. It's just a habit of thinking about God, of worshiping God on a regular basis. What I do is I actually on my telephone, I put an alarm on my phone. Every 2 hours, the alarm goes off. And then I think about God. I worship God a little bit, so that's what I do. And it helps a little bit, but sometimes, it interrupts your day. I'm focused on one thing and here the alarm goes off and then I have to think about God. So anyway, but that helps to keep. And Muslims, of course, do that on a regular basis. They pray to 5 days. So, whether you're Hindu, Christian, or Muslim, I think, thinking about God on a regular basis, being conscious of God, will just simply help improve your well-being, your happiness, and help you to live a healthier and a better life.
Thank you, sir. And there is a question from Susan Sharma, Bhaktivedanta Institute. What is your take on benefits of religious practices for science pursuits?
For what was that last word?
For the people who are pursuing the science or who are in scientific endeavor.
Okay, say that.
What is your take on benefits of religious principles?
I think the benefits of religious involvement apply to everyone, even scientists, even atheists. I think that keep an open mind, to the religious practice. That is what I would. It helps for everyone. It doesn't matter what you're doing, what your profession is. It can make a real difference in people's lives. I think that's been shown for healthcare professionals in particular, as you from the many studies that the Harvard School of Public Health has done. They've been studying nurses primarily, and it's among nurses that all of these, a lot of benefits show that. So even among healthcare professionals, it does seem to make a real difference.
Thank you. Maybe the last question from Dr. Jayanti Chavan. Excellent session, first of all. So your studies are very assuring. Sir, do you have any case or study where COVID infected could be cured through religious services without medications?
Oh my, now that is a question. Could COVID infection, right? COVID-19 infection be cured simply by religion?
By service.
Yes, okay. Here's what I think. I think if you are more religious, you will be less likely to develop the infection, the COVID-19 infection. And I think that if you get the infection and you are religious, you will be more likely to recover from it, simply because of the effects of religion on the immune system. It enhances the immune system. It reduces psychological stress that impairs the immune system. But having said that, I would get every vaccination, every immune shot, every booster that you can. And if you get sick, take every kind of medication that you can for that virus, and be religious. That way you cover all of your bases.
So one more question. So there are many questions. So we'll take one final question. This is from C.R. Sheshadri from Bombay. Since most of the research has been done between religious groups versus non-religious groups, it would be interesting to know if any comparative statistics data of research is available on these parameters, like death of despair or suicides or depression, by comparing these prominent religions between one another. That means between the religious groups.
Yes, I think it would be, I think it's very difficult to compare the different religious groups, because if your religion is measured in different ways, and different aspects of religion are, for example, among Christians, attending religious services is more important. Okay, that's important among Christians. Among Hindus, maybe worshiping within the home or practicing yoga may be more important. So it's difficult to study and compare the different religions, especially in different countries where the groups might be, for example, Christians are a minority in India, and Hindus are a minority in the United States. So minority groups are under more stress. So it's difficult to compare the religions in terms of the mental health. But in general, the finding is that those who are more devout in their religious practices, whether they're Christians, Hindus, Muslims, Buddhists, or Jewish, they are going to do better. Basically it. And if you compare, it's also difficult to compare individuals to compare atheists with those who are religious with no beliefs, because there are so few atheists. There are just not that many atheists in either the United States or India. Most people in India and the United States are religious. So there are just not enough atheists to compare them to. So anyway.
Okay. So again, sir, from the president, Bhaktivedanta Institute, Calcutta, there's a nice question. Sir, does your scientific research get same respect that science research gets, because our spirituality is involved in your research?
That's a very good question. And traditionally, it has not received the same respect. And the journals have not accepted the papers that have looked at religion, the top journals. But that is changing because of the work at the Harvard School of Public Health. The research coming out of that highly respected institution, it's done with such good methodology, is so good that it can't be criticized. So a lot of the top journals are now publishing the research, and of course that's getting around, and now religion is getting much more respect within the scientific community. And I think it's because the research is being done at the top research institutions. I think that's the key. So I do think that the credibility of this research is getting better, and I hope that some of the people who are listening here will come to the United States, learn how to do the research so that it can be done in India. We really need research out of India that is showing these same findings. And I know that it will show the same findings.
Okay. Yeah, thank you very much, sir. There are more questions, but we request participants to directly send their questions to MC, and we will facilitate sending these questions to our sir and then getting possible answers. So thank you very much, sir, for your wonderful session, and really it was very encouraging. Thank you very much.
Bye-bye.